One of the juggling acts parents with young kids face is what to do with their kids if they go back to work. Now in Ontario, all licensed childcare centres will be allowed to reopen on Friday with limits on the number of staff and children. There'll be screening protocols in place and increased cleaning, including removing certain toys more likely to spread COVID-19. Ontario is still reporting far more new cases each day than most other provinces, but there are signs of hope. There were 230 new confirmed cases in Ontario today, the second day in a row fewer than 300 new cases have been reported. Ontario's hospitals are able to handle all those cases, but they're now dealing with a new influx of people needing treatment for other conditions. As Mike Drolet explains, overcrowding is as bad now as it was before the pandemic.
At the height of the COVID-19 pandemic, Humber River Hospital in Toronto was one of the busiest in the country. For 3 months, healthcare workers were pushed to their limits.
Look over here and here.
But today, even with fewer COVID cases, hospital ERs are just as busy.
We had a lot of patients that may have needed to come in for care that were resisting a little bit. And so we're seeing people come in a little bit more, but we are still seeing people that have waited perhaps too long.
And while those patients are getting help, doctors say the system is once again being pushed to its limits. According to the Ontario Health Association, there were 5,200 patients in acute care hospital beds on March 1st who had been treated yet had nowhere else to go. As COVID-19 spread, that number dipped, but it's now back up to pre-COVID-19 levels. Before the pandemic, the problem was due to a lack of spaces in long-term care facilities. And now those same facilities can't take new patients until COVID-19 is under control, leaving hospitals to pick up the slack.
It's been shown over and over again, hospitals are terrible for people who don't need to be there. They need to get out of the hospital setting to prevent them from getting infections and all sorts of other complications in hospitals and be able to go back home.
The hope is that the Ontario government will begin easing restrictions within a few weeks, at least regionally, since most of the COVID-19 cases are in the Greater Toronto area. Mackenzie Health Centre in Richmond Hill, for one, tells Global News it's operating at 97% capacity, so a return to normalcy will take time. Elective surgeries, for example, had been postponed because of the pandemic, and there's now a massive backlog that can't be fully addressed until after fear of a second wave of COVID-19 has passed.
It's a precarious point for all of us, and that's as we watch really those numbers to say, as we start opening things up, what are we going to see?
And nobody wants to make that decision prematurely. Mike Drolet, Global News, Toronto.